Hello students, this is the third part of the chapter Role of Government in Health. Yes, it is true that the second part I was unable to send you because I don't know due to some technical problem the video didn't reach up to you. So I hope that you have studied through your book the what is the private sector and what is the public sector. So in health, especially in health, there is a two type of organization or sources who are providing us health services. The one is government sector, and this sector is owned and operated totally by the government and with the money that we people provide to the government as a tax. In these government health centers, medicines, treatments are provided to all the citizens, and every citizen can enhance to it, approach to it, because it take a very less cost or free of cost treatment can be get here. And because it cover a huge population, so it is scattered in rural as well as in urban areas. It starts from the rural area in the form of PHC, that is Public Health Center. As you have seen in your villages, these in public health center mostly there is one or two room and one doctor, one nurse and one health worker. So you can go here for your common illness like if you have fever, headache, stomach ache, any injury or vaccination also is done here. And above this there is a community health center which cover 4 6 7 8 village or more than this. It depends on the population, and there is a one hospital, big hospital, government hospital, that is in a district, that is called district hospital. In this district hospital there is many specialized ward, specialized doctors are present here. So when some diseases is uncurable in a primary health center, then that doctor recommend to you to go in a district health center. So these are the series or chain of a government health center. And now we move to a private health services. So these private health services is mainly present in urban area, and they are not operated by the government but operated by a individual or group of individual. The whole money that is um, invested here is by a person. So the profit, all the management and the people who are working here all are employed by that person. So in this private sector, person has to ex expend money more than the government hospitals. The people who there are very less people who can afford this private sector because they took a lot of money, because the medicines have a very high cost, and whatever facility they are provided to you, it it cost. So so there is a difference between public sector and private sector. And in your book there is a story given, and this is a story of two friends Aman and Ranjan. Page number 22 and 23. So if you read this story, so this will also enhance your understanding that what is the difference between public sector, public hospitals and private hospital. So please read this story also. So now we will move further. So healthcare and equality means, what is the relationship between healthcare and equality? Through this health sector, through the situation of that is prevailing in the all health sector, it helps you to understand the ground level situation of a country people, that every person equally can afford these health services or there is any differences. Like Men, women, children's, poor people, rich people, urban, rural people, all are equally can get these health services, because in India, as we are producing large number of doctors, we are the country where largest number of medical centers. So by overall, if you see from the above, so if it seems that everyone has to access to the health services, but it's not true totally. Everyone equally has not reached till up to the healthcare centers. Why? What is the reason behind it? The reason is that presently in India, the scenario is changing. What the changing means, the ground level reality is changing. That is, the private sector in health is increasing day by day, and private sectors is very costly. Every people cannot afford it, and these private sectors only confined it to urban areas, only confined it to town. The number of the private sector, the number of private hospitals, private doctors are very less in the rural areas. So if any village people became sick, and in village the primary health center, he cannot cure himself, so at last he has to go to the urban areas. But for going to urban areas, he needs money, and sometimes he do not have a money, and because of this he cannot go to a cities for his treatment. And these private sectors run for profit for every single thing. As you enter into these private hospitals, so at a reception, they first of all doctor will take a heavy fee, and then they will recommend to you a lot of a test, and after that test they will give you a lot of a medicine. So in all these steps, they earn the profit. And it's mean a person who approach to a private sector, private hospital, it need a lot of money, and every people have not enough money. It's mean those who are the poor, they cannot afford the private sectors, as in our country the number of a private sector is increasing. Now the private sectors is more than the government sector presently, and private sectors charge heavy cost at heavy expensive medicine they recommend to buy, and every person cannot buy these all these recommended expensive medicines. Sometime in private sectors they are practicing very incorrect method. Like sometime doctors prescribed unnecessary medicine, injections, saline bottles, or when a simple medicine can be used in place of that. But as doctor recommend that a person is, so sometime person compelled to buy it, he had no any option. And poor people, so poor people do not approach these doctors because they know that they have not enough money to buy all these medicines. And this is the this is a survey told us that only 20% people in our country can afford medicine whenever they ill. Many times poor people are deny or neglect their illness when there is a, because every diseases has starts from some common symptoms. Like they do not take it much seriously, like they have a headache or a stomach ache, so just they will go to a chemist shop and they will take a one or two medicine. They never go to doctor five for a test. So many times they neglect it, and when the problem will be increased a lot, then they will proceed to a doctor. So it's mean when they will proceed to a doctor, and then the illness became very large. At that time, doctor do not have any option, and sometimes they doctors recommend them for operation or for other expensive treatment, and because of this they unable to afford that. So it show that very less people can afford the heavy medical treatment, and there are many people, almost 40 to 50% people, that for the treatment they need to borrow money, because because every people have not a saving so that they can treat themselves or their family member. And especially poor families suffered a lot. If a person became ill in their families, then this can create a lot of anxiety and distress in their family. And if because they have a very less saving, and if someone became ill in their family, so all the money they have to invest in the cure of that disease. And sometime they do not have enough money to food at a two times. So this create a problem. And sometimes they do not have a money, so there is no medical treatment for them. And if you see in India, so mostly in a tribal areas, there is only public hospitals, and that public hospitals also do not have enough facilities. So tribal people suffered a lot, and whatever public sectors there is that do not run properly, only one doctors or two doctors are there. There is no test facility, so they also need to go to the cities for the proper treatment. And every people who are living in a tribal areas, they cannot afford this. And in tribal area, very rarely we find private health services that are available there. So now you can understand that all the peoples who are living in our country, it is true that in the constitution it is said that every people is equal. There would be no discrimination on the base of caste, gender, creed, religion, gender. But in the health sector, the scenario is saying that every people have not equal access to the health facilities. So what can be done? As you know that as you have seen that there is some problem. So if there is a problem, so solution should be also here. So first, it is the responsibility of the government to provide quality health care to all citizens, especially the poor and the disadvantaged people. Means this is the duty of the government that ensure that every people get equal health services. Means there is in our country there are doctor, nurses, but there is no equal distribution between rural and urban areas. So government should send more doctors to the more nurses to the rural areas, because our because still 60% population is living in a rural areas. And number of a health center, hospitals, laboratory for testing, ambulance services, blood bank, this also should be increased. And if they have to run hospitals, laboratories, so it's mean that they need health workers, nurses, doctors, and other professionals. So the number of them also should be increased, and they should be sent, they should be encouraged to work in a rural population, so that rural people do not need to come to a cities for the treatment, because it ultimately increase the burden on the cities hospitals. And फिर ये क्या करता है, किसी न किसी तरीके से सर्विसेज को इफेक्ट करता है. एंड द मोस्ट इम्पॉर्टेंट थिंग, health is not only depend upon the doctors. It's also depend on the basic amenities, as there is a proverb that uh, prevention is better than the cure. मीन्स कि हम किसी बीमारी को आने ही क्यों दें, उसको आने से पहले ही रोकें। तो कैसे हम क्या करें कि कोई बीमारी ना हो, इसके लिए हमें न्यूट्रिशियस फूड मिलना चाहिए, क्लीन ड्रिंकिंग वाटर होना चाहिए, प्रॉपर हाउसिंग होनी चाहिए, क्लीन एनवायरनमेंट होना चाहिए, पोल्यूशन फ्री एनवायरनमेंट होना चाहिए, मेंटल प्रेशर स्ट्रेस कम से कम होना चाहिए। Well, these are the basic amenities and proper social conditioning. If these things will be there, then uh, it will help us to be healthy. So health is very important thing in our life. It is said that money is lost, nothing is lost, but if health is lost, then everything is lost. So we will see the two example of one is Kerala and another one is Costa Rica, that what approach they adopt to address the health issue. So in 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to the panchayat. Now panchayat would decide and made a plan to spend the money on its own according to its own requirement. So they can made a plan for the housing, sanitation, proper water supply, primary health center, for Anganwadi, for the vaccination process, for creating awareness program, for a cleanliness program. So whatever is the requirement of a particular village of, so the village panchayat would be decide and would be spend the money. So now this start creating ground level changes in Kerala, and Kerala is the state who has a highest literacy rate in the country, and here child mortality rate and infant mortality rate especially is very less as compared to other part of the country. And here sex ratio is also high. Sex ratio means number of the girls is more than the number of a boy. Why it is so? Because here is women are educated. So this all things has happened because Kerala made some major changes to solve the problem of health. Second example is a Costa Rica. So Costa Rica is a healthiest country of uh, South America, and the major changes that can be found in Costa Rican constitution, that Costa Rica decided that they do not keep up the army, and it helped Costa Rican government to spend the money that the army would have used on health, education and other basic need of the people. So they work on to provide all the people clean drinking water, sanitation, nutrition, housing, and they make a essential part to a health education at all the level of its education, because if a people is aware for its health, then only people can do for the development of its own country, and also do progress, a healthy progress in their own life also. So these are the question answer. As soon as possible you complete this chapter and submit it to me.